Hello, my name is Tony. We're gonna do the assessment for musculoskeletal system for today, and my partner today is Teresa. She's gonna be the patient today. So my name is Tony. I can send for uh, video for education purposes, and I gonna be upload to the YouTube. So Teresa,
Yeah, hi, I am Teresa. I consent for filming for education purposes.
and then you allow me to upload to the YouTube.
Yes,
All right, for education only.
yes.
All right. So we go ahead, and then we have to provide the privacy for the patient in the office. Also, I washing my hand, and then explain to the patient what we gonna do the procedure for today. So, and also we see the patient walk in to the office or something. We see the gait, how the patient walk, any lumpy gait, or how the patient. So we know like some background for the patient. So for her, she have no problem. Uh, and then so I do access from head to toe for the musculoskeletal. I will start with the head first. So she sit down straight, and then there are no any scoliosis I see, and then the shoulder both side is symmetrical. There are no lesion. There are no sign of the inflammation of the joint or the muscular. And then we can ask the patient, do you feel pain on your neck?
No,
All right. So we just generally to see that, and then I'm gonna be go ahead and palpate the patient. So we're gonna be palpate for the temporal mastoid joint by pushing the two finger on the in front of the ear, and then ask the patient open her mouth. Can you open your mouth? And then close your mouth. So the temporal mastoid joint, there are no click, there are no repeters on the joint. And then we also prepare for any muscle like sternocleidomastoid muscle, and also we prepare for any subclavicle muscle around the neck, any muscle around the neck, and then uh, we prepare the cervical spine. There are no deformity, there are no protruding of the bone. And can you open your mouth at at wide as possible? And then she can open her mouth. She can you move your mouth left, right, left, and right? So there are no any problem for movement of the mouth. Can you turn your head on your left side again my hand, and then turn your on the right again my hand, and then the muscle each on uh, movement of the head each on bilaterally 5/5. Um, and then we're gonna do the range of motion for the patient. So we can ask, so can you put your chin to your chest? Can you put your head backward? Can you put your right ear to your shoulder and your left ear to your shoulder? And then you move your head from side to side. Do you feel any pain when you're doing that?
no,
So the patient have full of the motion, like she can flex her neck, she can extend her neck, she can uh, turn her neck on the left and right, rotate the neck. So there are no difficult, there are no tenderness, there are no limitation for the muscle on the joint on the head. And we can do the special test for Sperling test. So we just slightly ask the patient to, can you turn on the left? Turn, put your ear on your left. I'm sorry, like that. Okay, and just slightly put your head back. And then, okay, and then I put the breast shoe down. Do you feel any pain?
no.
Okay, the Sperling test we test for the cervical injury or something. The patient have negative, so she doesn't have any like injury in the spine. And next, I'm gonna go to the hand. I go from uh, distal to the proximal. For the proximal, distal from the proximal. Okay, so can you put your hand, two hand like this? Okay, so we check uh for the finger, the phalanx. There are no lesion. We see there are no lesion. There are no and then they have no missing any finger, the nail and the color is pink. There are no lesion. There are no swollen up the joint between the phalanges. The distal and proximal phalange is no swollen. There are no nodule. There are no abnormal finding when I see it. And then we slightly palpate what X1. There are no nodule. Do you feel any pain when I do something?
No.
Okay. So we're gonna do some random motion for the finger. Can you move just the finger, not your wrist? Finger down, flexion, flexion. No, not the wrist, just the finger. Just move the finger. Yeah, down and move up and move the finger inside here. Just move the finger inside. Oh yeah, just move around. Just the finger. Yeah. So full up the random motion for the finger. Can you make the fist? Okay. And then John, can you swing my hand? Open your hand and swing my hand both side. Okay. That is John bilateral with the hand grip 5/5, and then she can move the flexion, extension, and then in and then abduction and abduction of the finger. No limitation, no pain, nothing on the finger. And next we're gonna be see for the wrist. So we see any abnormality around the wrist, both sides. So there are no lesion, there are no deformity at the wrist or abnormal finding for the wrist when we see it. And then we're gonna be do palpate surround the wrist area, any nodule, any deformity. Do you feel any pain when I'm touching your wrist?
No.
Okay. Do you feel had a problem with your wrist?
No.
Okay, so the patient no tenderness when I'm palpate around, and then we have the specialty. We can do the random motion of the wrist. So can you put down, put up, put on this side, put back? Can you do like that? So she has a full. Do you feel any pain when you're doing that?
No.
She has full of the random motion of the wrist, like abduction, adduction, uh, and then flexion and extension of the wrist. There are no difficulty, and then the patient complain, no complaint of anything for any problem for the wrist, and we can test. We have the special test. We have the phalanx test. Uh, can you flex your arm and put like that? We check for the tunnel carpal syndrome, like the pain, inflammation of the wrist ligament. Okay, put on the way down. You feel any pain, numbness, tingling on your finger?
No.
All right. So she have a negative phalanx test, and then we do tennate test. Okay, can you relax? Tennate test. So we just flex a hyperflexion for the test, and then so I do on the left side, but I just demonstrate on one side on her left hand, and I tap around. But do you feel any pain when you do it?
No.
You feel any pain?
No.
So I tap on the medial nerve on the hand. So if the patient have the carpal tunnel syndrome, they're gonna be pain on the wrist area. So just hyperextend and then tapping around. Okay. So now we're gonna move up um, to the elbow. So for the elbow, I also inspect anything lesion, any deformity, any abnormal finding. When we see is a nodule or swollen, I don't see any of that here. And then just slightly palpate around uh, the elbow, or left the bones around elbow, any joint, any muscles around, and then ulna, and then radius bone. There are no thing problem for the elbow when I move. When I'm touching you, do you feel any pain?
No.
Okay. Oh, Okay, so right now we're gonna do the random motion. Can you make can you flex your arm? Okay, and then you just extend out. Okay, do you feel any pain when I do?
No.
Okay, and then can you put here supination and supination and donation, supination, right? Move everything out. Yeah, your elbow up, down, up. So see, do everything like flexion, extension, supination, and donation, full up random motion, and then no, can you put like that? Put again my hand. Okay, put again back, and then the muscle joint bilateral upper extremity is 5/5, and now we go back. We go up uh, to the shoulder. Again, we see any line lesion, and then symmetrical for both sides. There are no lesion, there are no deformity of the bone, there are no swollen of the muscle, there are no nodule, and then we palpate the joint, acrom, acromial joint around this muscle. So we palpate everything. We palpate muscle, deltoid. We, we go to the trapezius muscle. There are no pain. We go on the way, and then we do a random motion for the shoulder. Can you flex your arm on the way up? Okay, and then you put on the way to your back. On flex. Okay, so you can flex the arm and then extend on the way to uh, do again. Okay, just that. Okay, and flex on the way to on the back. Okay, so you can flex the, uh, and then extension the arm to 60 degree, and then to flex the arm to 60 degree, up to 180 to 80 degree. Okay, and then put your arm on the side like that and put back. Do you have the pain when you're doing that?
No.
Can you do the same on this side? Can you do all the way down? Okay, okay, and then put in the normal, and then put out, put back. You feel any pain?
No.
So you do the flexion, extension, abduction, and abduction both sides. There are no limitation. There are no difficulties in doing that. So right now we're gonna check for internal and external ro- rotation. So right now we do the internal rotation. Like put one hand, your hand on weight up on your back. You feel any pain? Can you do it?
No.
You feel any difficulty doing that?
No.
No. Okay. And then put your hand on your neck with 90-degree here. Just put 90-degree on the shoulder. Yeah. You feel any pain?
No.
So the internal external rotation, there are no limitation. Can you do again this side? Yeah. Okay. And all the way on your back. You feel any pain? No.
No.
So both sides equal, like the patient. There are no limitation for internal external um, rotation. And then I gonna check for the Hawking test. We gonna be bend the hand here, the Hawking. So bend the knee, but bend the elbow like that, 90-degree. Support the patient with this arm, and then slightly invert. Did you feel any pain while doing that?
No.
Okay. So I check for the spectrum test for the Hawking test. So the patient had negative. There are no problem um, for the protector cup on the right, and we're gonna do I just demonstrate one side. So after that, we're gonna be go to assess for her hip. So can you lie down on the bed? So we're gonna be assess for the hip. So for the hip, I don't see again like we do inspection. We don't see any like uh, one leg up and one leg down. Something an abnormal finding. deformity of the bone or the lesion or the nodule on the hip. And then we can do the random motion of the hip. So we can do the passive and passive uh, random motion first. So I will assist the patient. I can demonstrate only one side on her right leg only. So we do the abduction and then adduction, and we do flexion and extension down. Do you feel any pain?
No.
Okay. Inversion, exversion. Feel any pain?
No.
Okay. Can you do again everything? Like you put your leg up, put your leg down, put this one laterally, and put inside, and then try to move around inside. Okay, move out. Okay, so the patient doesn't have any problem for the hip. She can have a full up random motion on her hip. I just demonstrate one side, and she can do other side the same. She have no problem for that. So for the special test for the hip, we have um, tomat test. For the tomat test, we check for the uh, flexion deformity. So we just slightly bend the patient leg up and then put up on the belly. There are no deformity or contraction of the flexion of the hip. And then the Patrick test, we just slightly put the leg on the right leg to the knee and slightly put down. Do you feel any pain?
No.
No. So the hip, there are no problem with the hip. And then I also, because you lying that like that, we can do the tray leg test also for the spine. Can you tray your leg, dumbbell, okay? And then put all the way up. You feel any pain or something?
No.
So we check for any like deformity for the spine. Okay. So after that, we're gonna be go to the knee to assess for the knee. Also, we prepare around the area for the hip, everything. We prepare for, I'm sorry, I forgot. So we had to prepare for the hip. So we prepare for the bone, like anterior, superior, iliac rest, and with your canter here. And then can you turn on one side? Okay, and then we can see other area like we prepare for the bone on uh, the posterior superior iliac crest, and then we gonna be see the ligament between here. There are no problem for her. Just slightly prepare. And then now we go to the knee, access for the knee. So again, we inspection first. You don't see any like deformity. There are no swollen of the knee uh, lesion. And then I prepare for the bone of the knee around the patella knee, and then popliteal fossa around. I don't see any edema uh, for the her knees. And then we're gonna be do the random motion of the knee. So can you bend your knee on your right side? I only demonstrate one side, so she's gonna do the same on the other side in the reality. And then can you extend your knee? Again, can you do again? And then can you do the stand? Okay, so she can bend her knees. Do you feel any pain?
No.
Okay, can uh, okay, so right now we gonna be test for her so flexion and extension of the knee, there are no problem for her. So can you turn on one side? Okay. Can you extend on the way out? Can you put your knee on the way to your okay. You feel any pain when you're doing that?
No.
And then you extend on the way out on that side. Like you kick something. Okay. Okay, no. Okay. Can you go back? Thank you. So she can flexion and extension of the knee. There are no difficulty. uh, up the knee, and then I gonna be assess for any pain for the ligament pain for the knee. So I gonna be slightly bend the knee up, just slightly bend, and then I check. I put the pressure out to check for the valgus and marcus side, varus, the vagus and varus side. So there are no pain. So just slightly put out and put in. Do you feel any pain?
No.
Okay, no pain for the knee on the right side. And then I uh, I can do for the Lachman test by holding two hands, one hand on the superior of the knee and the below knee, and then push and pull the knee to check for any pain for ligament around the knee. Do you feel any pain when I'm doing that?
No.
No. Okay, and then I can do the jaw test for the patient, just slightly bend, and then I have to sit down on her knee, and then pull up, pull down. Do you feel any pain when I'm doing that?
No.
Okay, that's good. Um, and lastly, McCurvey test, we just slightly bend the knee and then just move the knee up and down. Do you feel any pain?
No.
Okay, no, okay. So they are all negative. There are no pain. The knee function. There are no rapitus when I'm doing that for her. And then I gotta be go down after the knee. I gotta be go down to um, the ankle. So as again, I check for the ankle. There are no discoloration uh, and, and the lateral medial malleolus. Their function. There are no deformity. There are no protruding. There are no swollen of the malleolus. And now I go to the palpation. I palpation the ankle, the malleolus on the lateral, and then the medial, and also palpate for um, Achilles tendons. So there are no abnormal finding. Do you feel any pain on your leg?
No.
On your ankle? Any
No.
problem? No. Okay. No pain when I'm touching you?
No.
No swollen, no edema. Notice. So right now we're gonna be check for flexion and then extension of the. Can you put your foot down? Put your foot up. So we do the plantar when. Can you put down again? That's a plantar flexion, and then um, dorsiflexion. Can you put up? So that's functioning of the knee. Can you do both hand, both foot? Yeah. So both sides equal. Like they can move, they can bend, no problem. Uh, so she have the functioning for the foot. Okay, can I put up and then put down? So muscle joint bilateral lower extremities. There are no problem. And after that, we go down to check for the foot. So can you move your toe? Can you move out your toe and move in? Okay, and then move inside, move outside. Okay, and then yeah, and then we for the toe we see like there are no lesion, there are no thing, and then she can move for a full up random motion for the toe, and she can flexion, extension the toe, abduction and adduction, and also see we prepare for any the ligament in the plantar side. There are no swollen. There are no thing. Do you feel any pain when do touching your toe?
No.
Okay, so that is full of the toe. So right now lastly we check for the spine. So we have to ask the patient stand up, and then we're gonna be okay. Okay, can you sit up and then stand up slowly? Okay, and then just slightly stand up here. We check for the spine, okay? Okay, so you can turn on this side. Okay, for the spine, we just see her like she stand up. Uh, they're symmetrical for both sides. Uh, and the shoulder is equal for both sides. The spine in the midline, there are no sign of scoliosis. And then the iliac rest on the same on both sides. And the skin below the butt muscle is equal and symmetrical for both sides too. And and then we're gonna be palpate everything. No, and then slightly ask the patient to bend forward. Can you bend forward? Can you bend a little bit forward? Okay. So there are no scoliosis. The spine in the midline and the shoulder are same equal both sides. A little bit forward, bending. Yeah. Okay. And then we palpate for the spine. So there are no deformity. There are no protruding bone on the spine. Do you have any difficulty when you're bending like that?
No.
Can you bend all the way to the? Can you bend more? So she can bend up to 90 degrees. Okay. Okay. Can we go up? Okay. Now we gotta do the random motion. Okay. So okay. Can you bend on your left? Can you bend on your right? Okay. Can you move bend up, bend forward, and then bend on the way on the back? Okay. So she can bending. Do you feel any pain when you're doing that?
No.
Okay. So she can bend uh, on left, on right, forward, and then backward. And then now you can turn your on one side on your right, and then you turn on the way on your left. Okay. And then you can she can turn on the left, on the right, rotate on both sides. There are no difficult for you to doing that.
No.
Okay, that's good. Sit down, please. So that will be ending our video today. Thank you for watching us, and
Thank
thank you
you.
for joining me today, Teresa. And have a good day.